On this episode, we'll talk about being hungry after surgery. We'll also talk about muscle twitching after your sleeve, and we'll talk about exercise stalling your weight loss. Hello and welcome to episode 175 of the AskDrA show. I'm Dr. Alvarez with Endobariatric.com, and today we've got a very good show with 3 of your questions. And if you're new to the show and you're interested in weight loss and you're interested in particular in the gastric sleeve, I would think about subscribing to the channel and hitting that bell button so that way you'll get notified every time we upload a video. And today, well, let me explain a little bit about how this works if you don't know, if you're new to the show. You can send me your questions. I'll be more than happy to answer your particular questions. We have a list, and the list starts getting longer and longer, but we'll add your question to the list using the hashtag AskDrA. All right, so hashtag AskDrA throughout social media platforms. My staff will be looking out for those hashtags and adding them to the list, and I'll be here for you. All right, so let's jump into the questions. Okay, so the first question for today is it normal to feel hungry after surgery? And it's a common question because the sleeve, supposedly it removes the hunger sensation. It's supposed to remove your hunger in your stomach. It's supposed to diminish your anxiety to eat. And here you are after surgery, just a few days after surgery, and you're feeling hungry. What's going on? Doesn't it supposed to be the other way around? Well, let me tell you that this is very normal at this phase, and it may repeat itself down the road in certain periods. And let me tell you why. Right after surgery, when your surgery is recently crafted, I'm talking the next few hours after surgery or next couple of days right after surgery, you may have this hunger sensation. And the reason is all this manipulation inside your abdomen, all this manipulation of your stomach, the cutting, the stapling, the sewing, everything that we do inside your abdomen to craft your new stomach for you to lose the weight, and remove this part of the stomach that gives that hunger sensation, that produces that ghrelin hormone, because we do remove that part. Then why am I hungry right after surgery? Well, all this manipulation that I'm talking about creates inflammation and this swollen tissue, and this tissue, your brain detects that as hunger, but truth is it's so swollen and normal and expected at this point. So we as doctors will give you some medication to start lowering this inflammation, this swollen tissue, and you'll notice a huge difference after about day 4, day 5. First few days, it's quite normal and expected. Now, I'll give you another example. Doctor, I'm 8 months or 12 months or 24 months post-op, and I'm starting to get this hunger sensation. Why is it? Well, you may have an episode of gastritis, and gastritis is an inflammation of the inner layer of your stomach that is producing, that is swollen, and your brain is detecting that as hunger. So a round of antacids or PPIs, proton pump inhibitors, it's a medication for acid production in your stomach. Taking it for a period of 3 or 4 weeks eliminates this and makes it go away. Can it return down the road? The answer is yes. Why? Because there's many reasons. Because you're stressed out, because you ate incorrectly, because you skipped a couple of meals, because you drank too much coffee, because you're smoking, because, it could be tons of reasons that you're getting gastritis, all right? So this may reproduce itself down the road, and again, another round of antacids should take care of it. Our second question is asking about muscle twitching right after your surgery, and is it normal? The answer is not that common. patients don't get this as common. But if you do have a lack of a nutrient, let's say potassium, and your potassium is running a little low, you may experience this. And it may be, normally it'll be like your eyelids just a little twitching right there. That's a common area. Another is the inner layer, the inner side of your thigh, little twitching that you'll feel. And sometimes, which is different, sometimes patients complain about that twitching right on the extraction area, which is different because the extraction area is twitching because that is the most manipulated area of the surgery, and it's healing, all right? It's swollen, and that's the twitching. Now, you can get some nutrients. Again, you can look into pushing a little bit more of food that contains more potassium. You can run some labs and see how your levels are. And this is just temporary, and it goes away, and you shouldn't be concerned. Nothing happens. On this last question, a patient is asking or telling us that exercise is stalling her weight loss. Is this normal? Yes, this is very, very normal. So what to do? The best advice is continue with the exercise. The exercise may be initially stalling your weight loss, but it's changing your body composition. So I will encourage you to continue with the exercise. You got to give it time, all right? Not because you've been going to the gym 3 days or 5 days or 7 days and you're getting on the scale every single day. Yes, you know who you are, all right? And you're freaking out because the scale's not moving. All right, patience. Remember that having weight loss surgery is a 12-18 month process, number one. 2, trust the process. Trust the process, all right? This will work. And number 3, you're doing what the guidelines say. You're doing what the doctor's telling you is to do. Go get some activity, go get some exercise. This is normal. Why is this? Because when you start exercising, the first few days, your muscles get swollen. You're all achy. It hurts. And the muscles are swollen. And with swollen tissue, there's an extra amount of water around that tissue that will make you at least stall or gain a pound or 2 of water retention. Normal. All right? As you continue, as you progress, as you keep at it with the exercise, your body adapts. But there's another important aspect about this. If you're doing weight resistance and you're gaining muscle, all right, that is also weight. So your weight loss will be different. Doesn't mean it won't happen. It just happens differently. But your body composition will be really good. That's what we want. We want you to gain the muscle, and at the same time that you're doing exercise, you're going to be burning the fat. And along with your sleeve, very, very powerful combination. So trust the process and keep at it. All right, so there you have it. That is it for episode 175 of the Ask Dr. A show. Thank you so much. Don't forget to send us your questions using the hashtag AskDrA. Give us a thumbs up if you found this interesting, helpful, and don't forget to subscribe to the channel, all right, and hit the bell as well. All right, I'll see you next time.